So on the PE, a lot of times patients that you're going to do OMM for are patients that tell you, is there something you can do for me today? Depending on their complaint and their issue, we're going to give you possibly different ways to screen the body, different treatments that you can do, and just things you should keep in mind along the way. So one of the preliminary things that they look for is your explanation about what OMM is. And with OMM, I usually tell my patients, it's kind of a whole body screening and diagnosis where we can palpate the body, look for areas of restriction, and try to bring the range of motion back to that part of the body so that we can get more blood flow to the body, help the body remove waste from that part of the segment or the joint, removing lactic acid, providing oxygen, lymphatic drainage. There's a lot of things that you can describe to the patient to help them understand what exactly we're doing when we are screening, what we're finding, and what we're doing when we use different types of techniques. And as you can see, the table is really, really high. A lot of the things they want you to see in the PE is that you're able to adjust the table, adjust the patient, and whatnot. So one thing that we tell you guys is the style screen. So I'll adjust the table appropriately for me. And during the style screen, we are going to evaluate the cervical spine. So make sure that you are, close enough to the patient. Is it okay if I palpate? If I touch your head, touch your back, and touch your lower back? Okay, great. And so you're going to kind of find and see where you see restriction. Like right here, I'm feeling some tightness. It's like resisting me when I'm side bending and kind of trying to rotate that segment. So I would say in the lower thoracics, there might be something going on. And I keep palpating all the way down. And remember, at this point, you can bounce on that SI joint and see if there's motion, if there's mobility. And we can scan the other side. And up on this side, and more upper thoracics, I feel, again, restriction on that area. And we keep going down, and a lot of tightness. And then again, we'll bounce on the SI joint. So that you guys can see what's going on, we're going to have the patient flip over. And we'll do the same thing. And we'll do it on one side for you guys to see. Remember, you're inducing rotation, you're inducing some side bending, and right here there's some restriction. So I know to come back to this segment to properly diagnose. And right here, there's a big, tight band. So I'm possibly thinking maybe there's a type 1 going on. These very hypertonic paraspinal muscles, actually. Remember, as we go down, we can bounce on that SI joint. And there's actually more restriction on this side than this side. So as we're here, you can also do the seated flexion test. Remember to appropriately find I find the iliac crest, and I'm going to bring my thumbs down, and I'm going to look for that PSIS. And there's one on this side, and here's this one. I look at their heights. I can have the patient bend forward for me and come back up, and he would be positive on the left. Remember, that's checking for sacrum, and then we can have the patient stand up. Stand up for me. And face that wall over there. And again, this one was assessing for anominance. So we're at iliac crest, and come down. And take your time, make sure that you really find them. And for females, they might be wider apart. For males, they might be closer. So just something for you to think about. And bend forward for me. Great, and come back up. And he's also positive as well. Sit down. Sit down. So that's one screening. The style screen, you can just go up to, from the neck down, depending on what the patient's complaint is. If they're having any kind of upper back pain, you're screening the cervicals, the thoracic, and the lumbar region. If they're complaining of low back pain, you're screening the whole region. You're seeing what the sacrum does. You're seeing what the abdominis does with the standing. Another thing we try with the standing. Another thing we taught you guys was the hospital screen. So we'll go ahead and do that. So lay down for me. And actually, let me have you with your head on this side of the table, and I'll bring this up for you. Hold on. Great. And lay face up with your head here. Okay, so for the hospital screen, a lot of times the patients might lay down inappropriately with the head towards the wall, with their stomachs on the table. So we're going to tell them, lay with your back on the table, with your head on this side for me, please. So just feel comfortable interacting with the patient. Adjust the table, find the chair, sit on the chair. You don't want to awkwardly be manipulating the patient or screening the patient. So they want to see that you guys are comfortable with all the tools you have. So for the hospital screen, so is it okay? I'm going to just touch up on your sacrum, on your backbone. We're going to palpate up all of your spine and up to your head. Is that okay? Okay, let me know if anything's tender or if anything feels uncomfortable. And don't try to help me. So, I'm going to bounce up on the SI joints and see if there's any kind of restriction. And there is restriction on his left SI joint, actually. And a little bit on the right. We're going to go up to the lumbar, and again, we're assessing for motion and seeing if we feel any restriction. What doesn't have a bounce? What's not, And you can see that the tension is actually starting to build as I'm getting up in this area. And then just screen the cervicals. I'm going to roll around, bring the chair wherever you are. And you can do translation, right? We're inducing side bending as we do translation. Or you can just go to the articular pillars and see which one feels more posteriorly. That's the side it's rotated to. And then you can assess the head. Put your fingers at the occiput and kind of see. What do those suboccipital muscles feel like? Are they hypertonic? What's going on? So that's the hospital screen. I showed you guys the style screen. Give an explanation to your patient about what OMM is before you do any kind of treatment. You can screen, you can diagnose, but talk to them about what the treatment entails, if they're okay with it, if they're comfortable with it. Remember, you need a diagnosis before you give a treatment. Okay, so we've shown you 2 screening methods. You only need to do one, so pick one that you're very comfortable doing, also depending on the patient. You can either do the style screen and have them seated, or you can do the hospital screen and have them lay down. So depending on what you're comfortable with, pick one, screen the body. You're screening multiple areas. Remember, as DOs, we're trying to find the area of greatest restriction. So going directly to where the pain is not what we do. We're looking for everything, we're screening the lumbar, the thoracics, the cervicals, the occiput. You're gonna screen everything as much as you can to try to figure out what is the main issue